Demand on your care, exploring intrinsic capacity. Integrated care for older people, ICOPE. When it comes to health checkups for the older people, society generally focuses more on medical conditions, putting the diagnosis and disease management at the center. Healthcare providers often pay more attention to older adults' blood sugar, blood pressure, and blood lipids, etc. Addressing these diseases remains important, but focusing too much on them tends to make us often overlook the decline in intrinsic capacity that come with aging, such as hearing loss, slower walking, weakness, forgetfulness, and so on, considering them as natural aging phenomena without seeking help. Also, the different health conditions associated with losses in intrinsic capacity interact at several levels. Hearing loss, for example, is associated with cognitive decline. Nutrition enhances the effect of exercise and has a direct impact on increasing muscle mass and strength. These interactions make necessary an integrated approach to the screening, assessment and management of declines in intrinsic capacity. Therefore, the WHO launched the Integrated Care for Older People, ICOPE, in 2019. It provided screening tools that enable caregivers and non-healthcare professionals to conduct a comprehensive and rapid health assessment easily for the older people. This helps to early identify older adult signs of intrinsic capacity decline, and implement multi-component interventions, appear to be more effective to maintain or improve physical and mental functions, and to slow down, stop, or reverse the progression of frailty or dependency in the older people. The ICOPE screening tool mainly assesses 6 key domains of intrinsic capacity. Here is a brief introduction to the reference indicators for each domain. 1. Vitality. Generally focus on nutrition. Has the older person unintentionally lost 3 kilograms or more in the past 3 months? 2. Cognitive capacity. Try asking the older person to remember the names of 3 objects. Then, ask him about the orientation in time and space, such as what year, month, and day it is today, and where he is currently. After that, ask him to repeat the names of the 3 objects you asked him to remember earlier. 3. Locomotor capacity. Assess the older person's mobility through specific movements, such as the chair stand test. With his arms crossed over the chest, how many seconds does it take for him to complete 5 consecutive stands from a seated position? 4. Psychological capacity. Over the past 2 weeks, has the older person been bothered by feeling down, depressed or hopeless? Has he been bothered by little interest or pleasure in doing things? 5. Visual capacity. Does the older person have difficulty seeing far or near or reading? Can he see clearly? 6. Hearing capacity. Pay attention to whether the older person needs to increase the volume when talking on his mobile phone. Will he not be able to hear clearly? Or often miss the call because he doesn't hear the ringtone? Do the family members say the volume is too loud when watching TV or when talking to others? He often needs them to raise their volume or speak again. Finally, if there is an abnormality in one or more of these domains after the assessment, the older person should seek community resources and approach primary health care center for in-depth assessment, which informs the development of a personalized care plan. The care plan may include multiple interventions to manage declines in intrinsic capacity and to optimize functional ability, such as by physical exercises, oral supplemental nutrition, cognitive stimulation, and home adaptations to prevent falls. Please visit our website, Facebook, and YouTube channel for more information on elder care. Before you leave, remember to like and subscribe our channel.